Hi, and welcome to the Burton Band's Posterior Kit demonstration series. We are today going to discuss indications for use of the super unique Burton Band's Posterior Kit system. In the previous videos, you have seen what the Burton Band's Posterior Kit is and what the kit contents include and why it's so unique and special. And this video is just going to demonstrate its indications for use and when it really achieves the results that you want to achieve, and in which situations it can really be helpful and streamlined for you. And so the basic one is any single isolated class 2 situation, so not a back-to-back. Back-to-backs do not go well with this system, and so it's best if there is intact adjacent tooth to perform against. And so any isolated class 2 that is not super wide, but it doesn't have to be ideal. You can break contacts. These matrix bands are plenty big to handle that situation. The other scenario in which it's very helpful is in these isolated MODs, and there's another video specific to that we will go over why it's so hard to get MODs set up, especially on bicuspids. But the system really behaves extremely well in these as it streamlines your access to the preparations. Another area that's key is between the cuspid and the bicuspid. So whenever you have a mesial lesion on a first premolar, it is quite difficult to get in because our rings don't do a good job of sitting on here. So we're at a transition point between anterior and posterior, and our matrix systems are specifically designed for either anterior or posterior, and so oftentimes we need something that's kind of in the middle. Does very well there. And then third, obviously, or the other one is this other isolated MOD, so it works on molars or bicuspids. And so we'll kind of demonstrate a few different situations here with it. And so just to kind of show you the basic layout of this system, we will just demonstrate it on the mesial of that isolated molar. So this is the Burton Band's posterior matrix, and so you can see that it is a very unique system. There are other systems that are similar where they have a matrix band attached to a wedge, but this one has a wedge that splits in half, and that does a couple different things. One, it helps stabilize the entire mechanism when you place it. But two, it's going to allow your matrix band to curve with the tooth as you place it, and so the matrix band won't jet straight out on the lingual or palatal here, and it'll help you seal that curve of the tooth. And so in these isolated class 2 events here, I'll just kind of show you how it goes. So you're just going to place the splitting wedge mechanism, and it's best to take one of the wings and just kind of press it against the tooth, and then just slide it gently into place and apply pressure like so. And there you have it, a wedge and matrix in position in one fell swoop. And so if we go to an MOD situation, all you're going to want to do there to make sure that you have is that you're going to want to make sure you have two different sided matrix bands. And so they come with a left and a right hand, right? So if you can see that the matrix band is actually adhered to two different sides of the wedges. So there's a left-handed and a right-handed. So this side will go from the buckle and have the matrix band facing this way, and this one will go from the buckle and have the matrix band facing the opposite way. So simply place in your MOD situation like so. And when you get into molars or little tight embrasure areas, sometimes the leading edge of this matrix band may want to get caught up, and so if you feel that happening, just simply take an instrument and press the matrix band out, and then continue to push your matrix band in place to make sure that everything is seated. And so if we zoom in closely on this or bring it up to the camera, you can see that we have matrix bands, sealed preparations, and everything's ready to go in one quick step.